Diabetic retinopathy is an eye condition that affects people who have diabetes. Most commonly it's seen in people who have type 1 diabetes, but you can see it in people with type 2 diabetes also. Generally speaking, diabetic retinopathy doesn't appear in people until they've had diabetes for about 5 years or more. We tend to see diabetic retinopathy when people have had elevated blood sugar levels for some time, so that causes damage to some of the tiny blood vessels that are in the retina at the back of the eye. So it can cause small bulges in the blood vessels initially. You can also see some leakage of fluid and blood from the vessels, which show up as hemorrhages at the back of the eye. Initially, there's generally no symptoms of diabetic retinopathy, so you can have mild levels of retinopathy without knowing about it. If that's left without treatment, things can progress, and the main symptom would be blurred vision. It can also lead to things like retinal detachment, which would give you symptoms of floaters or flashing lights. The way we identify diabetic retinopathy is by examining the retina at the back of the eye. This is usually done with a dilated pupil. Once the pupil is dilated, we would have a thorough examination of the back of the eye, and then we would take photographs of the back of the eye, which can then be compared with previous photographs to look for any changes that would require attention. So the best way to manage diabetic retinopathy is to manage the diabetes itself. So there's a variety of ways that can be done. Sometimes simple things like a healthy diet, exercise, don't smoke, and also taking your medication as prescribed to maintain good control of your diabetes, which will in turn lower your risk of developing diabetic retinopathy. It's very important for people with diabetes to have regular eye tests at least once a year, so that we can regularly examine the back of the eye and look for signs or changes within their diabetic retinopathy, so that action can be taken to prevent it from getting worse.